the meantime, I want to ask you guys, since my last video had been so popular and a lot of you had a good time watching the video and learned a lot from it. Dr. Soni, who is the pediatric infectious disease physician, had offered to do a weekly segments on the ever-changing landscape of the coronavirus. So one of the questions I have for all of you is whether you guys would like me to take her offer on this and provide the weekly segments on this topic. So with that, please, if you can say yes or no in the chat room. I'll also have a poll to see if you guys want this or not. So please, if you guys can type in the chat room whether you want it or not, and we'll go ahead with that. Uh, Today we'll have an episode, and we'll discuss some of the exciting breakthroughs in the field of epidemiology and what we're learning from the massacre and the deaths that happened in China. And we'll also talk about some of the developments on the clinical trials that are already up and started in terms of developing vaccines. Additionally, there are some studies, although in a very few minor patients, on use of some of the already existing drugs in helping target the virus and preventing its spread. And in fact, there are some drugs that are even been shown to be effective in slowing down the virus in those who are already infected. So what's one of the main reasons for me to do this live stream update today is that I've been seeing a lot of misinformation spread around on the internet. So I wanted to kind of bust some of that misinformation and also take this as an opportunity to do the polling about the weekly segments. So starting off with the first one, I wanted to update on the recommendations that the CDC has told you guys in terms of staying home and trying to quarantine yourself. This is something that needs to be followed to the extreme because it is one of the most important ways that we can flatten the curve. I know you guys have probably heard this a lot, but what does it mean in terms of flattening the curve? So epidemiologists have come up with a model in which they can predict the growth and the transmission of this virus throughout the population. Using data from the patients and the outcomes in China and Italy, the epidemiologists developed a model that will predict where the disease is potentially headed in America. In this model, what they were able to come up with, and the background information really briefly, is that if we assume in all of America there are 300,000 beds that could accommodate patients, this is all the beds that would be required for patients who are coming in with the coronavirus to be hospitalized. So if we assume 300,000 beds and we assume that each patient that comes in to the hospital needs to be hospitalized anywhere from 4 to 6 weeks. So with these assumptions and the assumption that on average about 5% of the people who are infected will require hospitalization, this model that the epidemiologists put together suggests that all of these hospital beds in America will be taken up by mid to end April. And come May, all the hospital beds would be completely full. And so any new wave of patients that are coming into the hospital will need to be evaluated in terms of how urgent it is for them to be hospitalized, because technically all of our beds would be essentially taken up. Now, this doesn't bode well for patients who are stuck without a hospital bed or a ventilator. So in order for us to change this timing of when the healthcare system would be saturated, what we must do is prevent the transmission of the disease, of the infection, by essentially decreasing our contact with one another and therefore decreasing the probability that you become infected. And not only that, you will take that infection and pass it off to somebody who will actually need hospitalization. So this is what's called flattening the curve. Essentially, what we're doing is taking the total number of people in the population who will require hospitalization, and there's no sugarcoating about that because Harvard epidemiologists also have shown that by mid-April to end April, we will have over 60 to 70% of the American population be infected with the coronavirus. So with these numbers, the number of beds being limited, by May, we're going to saturate the system. So by staying home, washing your hands, following the CDC recommendations, we will be able to help spread the number of patients over a longer period and therefore allowing the healthcare system to work at a level that they can accommodate all of the patients that will require hospitalization. Now, these are some more optimistic estimates. So if we don't follow these, the trajectory is going to be very close to what we have right now in Italy. So therefore, please, I urge you guys, if you are young and healthy, even if you think you're not going to get sick, stay away from socialized activities. I'm not saying don't call people on the phone, don't do stuff from home, but what I'm saying is please do not go outside if you don't really need to. And some of you are working from home, but don't let this be an opportunity for you to go on a vacation, right? This is not a vacation. There's a real reason why your employers are asking you to work from home. The reason for that is because we don't want people walking around communicating with one another, and through which they could start transmitting the virus. So I really wanted to harp on that issue because looking at the model that these epidemiologists developed, this is one of the main factors in slowing down the transmission of the disease. So now I'll take a look at some of these questions that people are asking and continue. One of the questions is, are you truly concerned about this or is it just a media hype? Now, that's a sort of a loaded question. Am I concerned? Yes. Am I concerned for the deadliness of the virus? No, the virus itself doesn't have the potency to cause damage as much as, let's say, some other viruses like Ebola or the swine flu. But because the virus has a very high infectious rate, it's going to spread through the population much, much, much faster. And the thing that I'm worried about is twofold. One is the saturation of the healthcare system, like I mentioned just now, which means even though people might not die, they will still require hospitalization. And as a result, if the hospital beds are completely saturated, then even people that we would be able to treat are not going to be getting treatments. This is sort of what's happening in Italy, in that the people who we could have treated and saved them, we don't have the means to do it because everywhere it's essentially saturated. So that's one scary part. The other scary part is that there's a large susceptible population in America who can potentially die if the virus infects them. So yes, the great majority of us will probably not even feel the symptoms of the virus, but there are significant proportions of people in America who could die from this. And given the rate at which it's spreading, this will definitely be something to be worried about. So hopefully that answers your question. Well, just to clarify, what I meant was anybody who is sick enough that will require hospitalization will be essentially saturating the system come late April, mid-April, early May. So everybody who is infected will not need hospitalization. In fact, what we're recommending is that if you're a young person without any comorbidities, which means any health conditions such as heart disease, diabetes, or recent surgeries, or you're on some kind of an immunosuppressant for autoimmune diseases, or are going through a cancer treatment with some very strong chemotherapeutics. If you are if you don't fit into any of those categories and you just feel a little bit sick with a headache, slight fever, cough, we urge you guys to stay home. Not everybody needs to go to the doctor. And moreover, we don't want those people coming into the hospital or the doctor's office because they might not even have the virus. They might have something else. But by coming into the hospital or the doctor's office, they're going to start increasing the likelihood that they will in fact contract the infection. So please try to call your provider before going to the office, and if you can, avoid going to the doctor's office altogether. In fact, there's nothing much that could be done in terms of treatment, so you showing up to your doctor's office isn't going to do any good. And of course, yes, respiratory issues are also a major concern as the virus attacks the respiratory system as one of its main targets. So hopefully I've addressed some of your questions already. So the other exciting thing that has been happening in terms of drug development and vaccinations is that there are a couple of drugs that have shown to have promise in slowing down the progression of the infection. One of them is called hydroxychloroquine, and this is an anti-malarial drug that has been used for a very long time. There are reports that the drug is very effective, although in certain institutes that it's already being used, they've had mixed effects. Overall, it has promise, and the data still needs to be sorted out and sifted to make sure that the side effects of this drug, which can be liver damage, is not significant enough where we start causing more problem than good. So therefore, we need to make sure that the data actually suggests and warrants us using it as a medication to combat the infection. The other medication is remdesivir, which is a a drug that had been developed against Ebola, but because it did not show efficacy, it sort of was shelved. Now scientists and physicians are demonstrating that this drug is also able to combat the infection. So both of these are starting the clinical trial phase, and hopefully we will get some really good outcomes and therefore be able to use this drugs in treating patients. The other important sort of advance is in the field of vaccine development. Now, some people are asking me how long is the vaccine going to take? When can we expect the vaccine? Well, based on prior experiences with developing vaccinations, it would take at least another 6 to 8 months before we have something that could be started on a clinical trial. Even the ones that are started right now, it will take another 8 to 12 months before we could start using these on a global level on everybody. And the reason for that is we need to take cautious steps because we don't want to develop something that will hurt people more than help. So hopefully with some of these developments, we will be able to come up with a vaccine in the very near future and be able to slow down the transmission. Now, these are all the good news. I also have a few sort of bad news that I wanted to sort of convey. That way, most people who are shrugging this off as just another flu will understand the severity. One of them is that there are reports that there are some pediatric populations that are also showing up to the hospital. Now, these sources have agreed to be anonymous, but the data is emerging that there are some people who are healthcare professionals and are seeing pediatric patients showing up. Now, the data from China suggested that the pediatric population is essentially, let's just say, resistant to this, although they can get infections, but it might not be the case. Now, whether the data wasn't comprehensive in China or they didn't really look at it deeply, or they might have missed some patients due to for whatever reasons. Or the second option is that the virus could have changed because we know there are two strains at least reported, although not fully confirmed, of the virus. So it could have been potentially mutating, and now it can affect the pediatric population. So we'll see what the developments are in that front. The other one is that a significant majority of Americans will be infected with the virus. Like I mentioned, about 60 to 70%. Now, this will cause a significant burden on the healthcare system. Additionally, this will cause a significant burden on the economic front. I'm not an economist. I don't study the economy of the United States, but based on what I've heard and been reading, this could put a huge dent on the economic progress for this country. So, what I urge you guys to think about is spend your money properly, think about what is actually needed and what is truly important at this moment in time. Because believe it or not, this virus isn't going to go away within 2 weeks, as some people thought. Because people are saying, hey, you guys are giving us the recommendations to be under quarantine for 2 weeks or 10 days or a month. Does that mean after that we're free? No. Chances are the virus will linger on into late August and September. In fact, these kinds of coronaviruses have a cyclical pattern. So even if the infection transmission begins to drop off come August, September, it will reemerge eventually again next year. So this isn't something that's going to go away. So please consider this when thinking about the way you spend your money, what you're doing right now, and what you should be thinking about long term. Additionally, we know that the coronaviruses are types of viruses, like I mentioned, that will reemerge. So this makes the importance of having a vaccine very, very, very high. So this is why there is strong push to develop the vaccine. Now, with all this doom and gloom, I want to mention a couple more really quick updates that just was brought to my attention today, and I wanted to share with you guys so that we can potentially end this in a happy note. One of them is that a dear friend of mine shared with me an article which analyzed the infection rates in different parts of China. And what they were able to find is that temperature and humidity correlated with the rate of transmission of the virus. Specifically, higher temperature and humidity slow down the progression of the virus. So this offers the potential that come summer, when the warmer weather uh, follows and the humidity in the northern hemisphere increases, we will potentially see a slowing down um, of this virus. Now, this is not a guarantee, but it suggests that we may potentially be able to see the rate of transmission decreasing, which could also help with the flattening of the curve. Now, we're not going to wait for the heat and the summer to do a cure, but of course, having that as an extra bit of help will definitely play a significant role. The other one is that an antibody was recently identified which blocks the entry of the virus into the cells. So with that, hopefully we can develop this antibody into a drug or even a vaccine. In fact, the data currently is showing that the antibody is not only able to block its entry, but could be used to prophylactically prevent infections, period. So again, there's a lot of information. This is an ever-changing topic. What was said yesterday might not necessarily be true today and might not be true tomorrow, because as more and more data is coming in, the models are being refined, and changes are being made into the decisions, both scientifically and on government level. So please stay updated. Look for the sources of information that are credible in order for you to make your decisions. And so based on that, I wanted to again ask you guys if you want to have the weekly segments with Dr. Sony to talk about the recent developments. And like I mentioned, I will be doing a show with her today, and we'll be posting that up really, really soon later on tonight, in which we will talk about the two specific drugs that I mentioned, hydroxychloroquine. Additionally, she will talk about some of the burden that the healthcare professionals are feeling in terms of lack of testing, lack of N95 masks, and in fact, there's some data now showing that there are droplets that can transmit the infection, which means that our protective equipment needs to be modified, and moreover, fomites can actually start to transmit the virus. So these will be all the topics, in addition to another interesting one which hasn't been really brought up, but of course there are people right now who are pregnant and having kids. What happens to those newborns when they're born? If the mother is positive for the coronavirus, does it get passed on to the newborn? So these will be the topics that we will discuss today, and I will update them. I'll upload the video immediately right after. So stay tuned for that. And if you guys want, we will be doing weekly segments, like I mentioned, on this, so that we can update you guys on the most important and the most credible data that's coming out. In addition, if you guys have any questions, please feel free to drop a line in the chat box, or you can email me and I will try to address them in the subsequent episodes. So the email that you guys can send would be scitalks2.0@gmail.com. Once again, I'll put it on the bottom later on, but it's scitalks2.0.com. So I'll take a look at if there are any last minute questions, and then I will end this brief live stream, and we'll update you guys with the video later on this evening. Are there any cases of virus at your hospital? Well, without giving away too much exactly where I am, yes, there are cases at my institute. There are cases all throughout Chicago that have been reported. In fact, I know people who are currently under quarantine, nurses who were accidentally exposed to the virus because they were treating a patient that was not initially shown to be positive for corona, but later on became positive for the test. So yes, there are hospitals around my area that are seeing patients. We're also seeing a lot of false negative, but we're also seeing a lot of true positive tests coming in. And we're all prepared to know that this is only the beginning. Uh, we haven't seen the full force of this virus yet, and unfortunately, we will in the next couple of weeks when this will hit its peak. Why is this virus treated differently than influenza or many more serious viruses? Good question. So the thing about it is that because we don't have any vaccines against any of the family members of the coronavirus, there is no immunity amongst the population at all against these. So in the case of influenza, because of the flu vaccine, we have some level of protection. Although there are people, 20 to 30,000 people have died from the flu just this year. So it's not like the vaccine has eradicated all of the flu. But because there is some level of what's called herd immunity, those individuals that are susceptible to the virus and are prone to being really sick from the influenza are protected because a great majority of the population has some level of immunity. But the coronavirus, because we don't have any vaccinations against it, a larger number of people are going to be exposed to it, which means that the susceptible group will be more likely to contract and therefore have severe consequences from that. So again, initially most of us thought that yes, it is just like the flu on steroids, but given the transmission rate and also the lack of general immunity, this makes the virus slightly more serious and something that we need to really be thinking about. Um, okay, so that was sort of the last question, and along those lines, the other thing that I want to tell you guys is that again, there's no sugarcoating. This will catch on fire pretty quickly. This is only the beginning, and we haven't seen the true power just yet here in America. We're seeing what's happening in Italy, and we've seen what's happened in China. So what I want to tell you is that yes, quarantining yourselves is difficult, but brace yourselves to the fact that this might take a really, really long time. So don't think that this will be a 2 week and then goes away. So mentally, I want you guys to prepare yourself for this social isolation because we don't want psychological burnout of this uh, social isolation happening because yes, you may be able to sort of um, um, prevent yourself from doing your normal activities for 2 weeks, but can you do that for 3 weeks, 4 weeks, or 5 weeks? And it's something that we should all feel prepared to do because this could actually drag on very long and we don't want to have burnout. So find ways to keep yourselves entertained. Watch YouTube videos like this one, and find also ways to keep yourself healthy by exercising, doing things around the house, and also make sure that the kids don't think of this as vacation and ask to go to the playground or to the park. Please avoid doing all of this. So if you guys don't have any more questions, I want to thank you all that have joined, and please do let me know if you guys want weekly segments on this topic with Dr. Sony. We will do our second one today, and like I mentioned, I will update that, and then based on the outcome of the poll, we will consider doing this as something on a weekly basis. So with that, please stay up to date on your vaccines, wash your hands, and do as you're told in terms of the recommendations. And I want to wish you all a happy, healthy day and look forward to seeing more of you in the future. With that, I want to thank you all and want to wish you again a healthy week.